Hello guys, welcome back to Clinically Clear. Today I'll be covering a very important topic, that is integrated vector management. Now the reason why I've covered it under a separate video and not under the malaria video is because this integrated vector management is applicable not just for malaria, any of the vector-borne diseases, dengue, chikungunya, filariasis, Japanese encephalitis, any of those. So that is why I'm covering it in a separate video. Okay, so what is IVM, Integrated Vector Management? The efficient use of all the available resources to reduce transmission of vector-borne diseases. Some common sense, put one introduction, common sense sentence. Then the best method to control vector-borne diseases is to reduce the source itself. What is the source? The breeding area, basically the stagnant water. Cheapest method, best method. So what, you'll put certain bylaws for construction sites. When you're constructing high-rise buildings, you should not let too much stagnant water be there. You should not you should drain out all the excess water, etc. Then you'll maintain drainage facilities, you'll improve drainage so that there's not standing drainage water, etc. You'll advise farmers, etc. You'll advise farmers to do intermittent irrigation so that they don't irrigate at once a large amount of water, so that it will be standing water. Then again, mosquitoes will breed. Basically, water level management. This is source reduction. This is the best method. Next, what you can kill? You can kill the larva. So anti-larval measures. Here you have physical methods. Physical methods, you will add mosquito larvicidal oil over the water body. It will form one layer over the water. So after 8 days, what will happen? No oxygen will enter the water. So larva will get asphyxiated. But problem is, fishes will also die. Fishes will get asphyxiated. And you can't drink the water because there's a larvicidal oil. And this mosquito larvicidal oil also is very, very expensive. So very, very expensive. So unfit for drinking, and fishes will also die. This is physical methods. Coming to chemical methods, you will put larvicides. Two most common larvicides, Paris green and abate. Paris green is acetoarsenate. Abate is temifos. Paris green, green color. Abate, brown color. Why do we prefer abate much more than Paris green? Is abate 100 grams, if you put abate in water, it is enough to kill the larva. Whereas Paris green, you need 1 kg per hectare. So that is why we prefer abate. Whereas Paris green is a stomach poison. The larvae will ingest Paris green and then die. Abate is a contact poison. Just contact with the larva is enough for it to kill the larva. So that is also one more reason why temifos or abate is preferred. So chemical larvicides. Then biological. Larvivorous fish you will add in the pond, like Gambusia, Poecilia or guppy fish. Then biocides like Bacillus thuringiensis. Basically, larva will ingest this bacteria and Bacillus thuringiensis will kill the larva. So biocides like Bacillus thuringiensis, very, very important biological larvicide. So larva you're killing, that is one level. Next is you are also trying to kill the adults, anti-adult measures. Adults will be flying around. You can't put any powder or oil or anything. All you can do is spraying. Spraying can be of two types, residual spraying and space spraying or fogging. So residual spraying is the most effective, even though it has a delayed onset after 6 to 8 hours, because wherever you spray, there will be a lot of residue covering everywhere. It will have a long duration of action. Whereas space spraying or fogging, what you're doing is you're using a mist machine. Basically, you're spraying it in the form of aerosols or mist. So very, very quick onset of action. You don't have to wait for 8 hours. But short action. Why? There is no residue, non-residual action. What are these adulticides? Chemicals that kill adults. Olden days, heavily used DDT, dichloro diphenyl trichloroethane. So 1 gram of DDT has to be sprayed for meter square of area, and because it has residual action, 6 months once also if you do residual spraying of DDT is more than enough. But DDT nowadays not commonly used. First of all, it is an insoluble white amorphous powder. So you have to mix it in some other organic solvent, etc. Biomagnification. What is biomagnification? I hope all of you remember from high school. Basically, let's say a plant has 1 gram of DDT. Then a grasshopper will eat 15 of those plants. Grasshopper will have 15 grams of DDT. A frog will eat 10 of those uh, grasshoppers. That one frog will have 150 grams of DDT. A snake will eat 5 of those frogs. So 5 into 150 grams of DDT will accumulate in the snake because it is never leaving the body. So that is biomagnification. I hope you guys understood. Then main problem is resistance, but DDT resistance in mosquitoes. Mosquitoes no longer die to DDT only. They have become resistant. Then you have certain other OP compounds like malathion, fenthion. Malathion is most preferred. Why? Even though you have to put 2 gram per meter square for once every 3 months, but no resistance and none of this biomagnification and all. Malathion, parathion, fenthion, these are all organophosphorus compounds, OP, whereas diphenyl trichloroethane and benzene hexachloride, BHC, these are organochlorous, OC compounds. So that is one key difference. You also have another very expensive adulticide known as pyrethrin. So give some examples. 3, 4 is more than enough. So you kill the adults also. You're trying to kill the adults. Last measure is you don't want this thing to bite you. You don't want the mosquitoes to bite you. So for that you have personal protective prophylaxis. So how do you protect yourself from getting bitten by mosquitoes? Using mosquito nets, standard mosquito nets. But problem is not that useful also. Some tear will be there, some small hole which is bigger than the size of the mosquito. So what you'll do, you treat it with insecticides. That also, some insecticides will only last for a short while. Best is long-acting insecticide treated nets, LIN nets. Long-acting insecticide treated nets, example pyrethrin treated nets. For 6 months also, the insecticide will be there in the mosquito net and it will repel the mosquitoes, it will kill the mosquitoes. Then using appropriate clothing, you will cover yourself with clothing so that less exposure for mosquitoes. And mosquito repellent. Mosquito repellent, don't write Odomos. What does Odomos contain? Odomos contains DEET, diethyl toluamide. These are repellents. They don't kill the mosquito, but they repel the mosquitoes. And one more thing you can remember is the anti-malarial month is June. This is another strategy, MCQ question. Write that, extra maybe half mark or something. I don't know. But this is integrated vector management applicable to all mosquito vectors. Very important. Comes under many different diseases. Hope I did the topic justice. Thank you for watching as always.